Welcome to Root Cause CSI, where we investigate health through an integrative lens. I'm Joan Lu, a functional medicine practitioner and someone who once sat on the other side of the PCOS diagnosis. This podcast, we are learning how to think critically, ask better questions, and understand the signals the body gives us. If you're ready to move from confusion to clarity, let's begin. PCOS is not always visible. It's more than acne, more than irregular periods. Weight gain may or may not be present. It can show up as fatigue, mood shifts, stubborn abdominal weight, infertility, or feeling like your body is unpredictable. And depending on which medical lens you use, the explanation for PCOS may look different, but one goal. Today, we are going to explore PCOS through three lenses: conventional medicine, functional medicine, and traditional Chinese medicine. It is the same condition, but three insightful interpretations. Through the conventional medicine lens, PCOS is defined by diagnostic criteria. Typically, two out of three features must be present: irregular or absent ovulation, elevated androgens such as testosterone, and polycystic appearing ovaries on ultrasound. It is classified as a reproductive endocrine disorder. Management they offer often focuses on regulating cycles with hormonal contraceptives, improving insulin sensitivity with medications such as metformin, managing androgen symptoms, or supporting fertility when pregnancy is desired. This framework is structured, evidence based, and important for risk reduction, especially for long term concerns like type 2 diabetes or endometrial changes. But when I was first diagnosed, this was the only lens I was shown. I was given labels, I was given predictions, I was told I would never get pregnant. I was told that if I did, I would miscarry. I was even told I had endometrial cancer. I saw one gastroenterologist, four OBGYNs, one endocrinologist, and three dermatologists. The system was not wrong. It was doing what it was trained to do, but it felt incomplete. I did not just want symptom management, I wanted understanding, hope, and a family. Functional medicine practitioners ask a different question. Instead of asking only what diagnosis fits, it asks why the pattern is happening in the first place. In this lens, PCOS is rarely viewed as just an ovarian issue. It is metabolic. We see patterns such as insulin signaling, blood sugar rhythm, chronic inflammation, stress physiology, sleep quality, gut health, and nutrient status. Insulin resistance plays a central role in many women. When insulin remains elevated, sometimes long before blood sugar appears abnormal, it signals the ovaries to produce more androgens. Elevated cortisol from chronic stress can raise blood sugar, which raises insulin, which can further disrupt ovulation. The ovaries are responsive organs. They react to the metabolic environment they are placed in. This was the lens that changed everything for me. When I stabilized my blood sugar, reduced inflammatory load, improved my sleep, and stopped pushing my body through chronic stress, my cycles began to shift. One day, my ultrasound came back clear. Within a month, when my husband and I decided to start a family, I became pregnant without fertility medications and without miscarriage. That experience reshaped me. It showed me that when the internal environment becomes more stable, the reproductive system often follows. Traditional Chinese medicine offers yet another perspective. In TCM, there is no direct label called PCOS. Instead, TCM doctors identify patterns of imbalance. The language is different, but the themes are familiar: stagnation, dampness, depletion, disrupted rhythm. Irregular cycles may reflect disrupted flow of liver qi. Cystic structures may be viewed as phlegm accumulation. Fatigue may reflect spleen deficiency. Hormonal instability may reflect kidney imbalance. TCM does not isolate the ovaries, it sees the entire system. It focuses on restoring the rhythm, supporting digestion, calming the nervous system, and improving circulation of energy and blood. In many ways, this lens validated what I felt for years: that my body was not broken, it was out of rhythm. When we step back, we see something powerful. Conventional medicine gives us structure and diagnostic clarity. Functional medicine investigates upstream metabolic drivers. Traditional Chinese medicine teaches us about systemic balance and rhythm. These lenses are not competing. They are different maps describing the same terrain. PCOS is not simply ovarian cysts. It is altered communication between metabolism, stress physiology, and reproductive signaling. When we only silence symptoms, we quiet the signal. When we listen more carefully, patterns begin to emerge. For years, I was told what my body could not do. I was told I would never get pregnant. I was told I would miscarry. I was given labels, but not clarity. What I eventually learned is that my body was not failing me, it was communicating. And once I stopped fighting it and started understanding it, everything began to shift. Not overnight, not magically, but consistently. PCOS is not a life sentence, it is information. And information, when understood correctly, becomes power. You are not your ultrasound. You are not your testosterone level. You are not your irregular cycle. You are a dynamic, adaptive, intelligent system capable of recalibration. When insulin rhythm stabilizes, inflammation quiets, and stress becomes regulated, the body often responds. That is not luck, that is physiology. So, if you have been diagnosed with PCOS, do not reduce yourself to a label. Seek clarity. Understand your pattern. Ask better questions. Because when you understand what your body is communicating, you move from fear to empowerment, and that is where real changes begins. Thank you for listening to Root Cause CSI. Until next time, keep investigating the root cause and keep trusting that your body is capable of restoration.